My assignment is about sports acquired brain injury and chronic traumatic injury. So neurological functions and adult services implications. Acquired brain injury in sports has become increasingly important in public health issue as research continues to reveal the long-term neurological consequences of repetitive head trauma. Although concussions are often viewed as short-term injuries, evidence suggests that repeated impact can lead to lasting structural, functional changes within the brain. Acquired brain injury, or ABI, refers to damage to the brain occurred after birth, is not congenital or degenerative in origin. Within the context of sports, ABI most commonly results from concussions and repeated subcon subcognitive impacts. Subcognitive impacts are blows to the head that may not cause immediate symptoms, but also disrupt the normal brain functioning at the neurological level. These types of injuries, especially common in contact and collision sports, such as football, hockey, rugby, boxing, and soccer. Neurologically, sports-related injuries occur during the rapid acceleration and deceleration forces that cause the brain to shift within the skull forward and backwards, or sometimes sideways. This movement can lead to axonal shearing, neuroinflammation, and disruptions to the cellular metrum. Following a concussion, the brain enters a vulnerable neurometric state. During this period, the brain requires increased energy to restore the balance, yet they reduce the cerebral blow available to meet these demands. If additional impacts occur during the recovery, the likelihood of cumulative and potentially permanent damage increases significantly. Over time, repetitive head trauma has been associated with development of chronic traumatic epilepsy or CTE. CTE is progressive neurological degenerative condition linked to repeated exposure to head impacts, characterized by the abnormal accumulation of hypnopaxil 2 protein, particularly around small blood vessels and at some depths of chronicle sulci. These pathological changes are mostly common observed in the frontal and temporal lobes. Which are areas respond reasonable for executive function, emotional regulation, impulse control, and behavior? Unlike other neurodegenerative diseases such as Alzheimer's diseases, early symptoms of STE often involved in behavioral and emotional changes rather than memory loss. Individuals may initially present with irritability, depression, anxiety, impulsivity, emotional dysregulation as the disease progresses. Symptoms frequently expand to include executive dysfunction, memory impairment, empathy, aggression, eventually leads to also dementia depending on how you get hit and how long the duration of the lasting effects are in later stages. So this basically goes over. From adult services perspective, individuals living with sports-related ABI suspect CTE often fall between symptoms of care. Many are younger or they are middle-aged adults who do not qualify for geriatric dementia services, yet experience progressive cognitive, emotional behavioral decline. As a result, they may struggle to access appropriate neurorehabilitation, mental health support, vocational rehabilitation, and long-term planning services. Damage to frontal and limbic brain regions frequently result in impaired emotional regulation, poor judgment, and reduced impulse control. These changes can significantly affect employment, stability, interpersonal relationships, and overall quality of life. Without adequate support, individuals may face increased risk related to substance use, unemployment, and justice system involvement. Additionally, many former athletes experience identity disruption following brain injury. For individuals who personally identify as social status were closely tied to sports participation, cognitive or behavioral decline can result in grief, reduced self-esteem, and difficulty adjusting to new life roles. Adjusting these challenges require the interdisciplinary approach that includes neurological assessment, psychological support, occupational therapy, and community-based services. In conclusion, the sports-related acquired brain injury and CTI represent the complex and multifaceted conditions with significant long-term implications for adult functionings. Understanding the neurological mechanisms underlying repetitive head trauma and the progressive CTE essential for developing effective adult services. Early recognition, coordination, rehabilitation, sustained monitoring are critical to supporting individuals affected by sport-related brain injury across lifespans.
Hi, my name is Haley, and I'm gonna speak about uh, psychology impact for sports. When we talk about sports related to the brain injuries, we often focus on the psychologist's hit. But the invisible injuries happens in the front limbic system, the part of our brain that acts as an emotion traumas. When that trauma is broken, attendance is just not feel sad. They feel more like they mostly feel an experience anxiety and depression that they can't simply tout their way out. Most sobering they reach shows strategies that increase the risk for the individuals. We have to treat emotional monitoring as a high stakes life-saving invitation. Behavior shift and the family systems. The injuries doesn't just stay within the attendance. It radiates outwards. We see the behavior changes, aggressions, and that can make attendance unrecognizable to their loved ones. They create a ripple effect where their family becomes the shadow's patients. For many of these individuals, being an athlete is not just what they do, it's who they are. When the brain injuries force them out of the game, they are not just losing a job, they are losing their identity. This drives a unlimited of misunderstood from of grief. As they move into the standard life, they feel like stronger in their own skin. The final hurdle is the system itself. There is still a massive stigma in support culture about admission weakness, which keeps athletes from seeking help. When they finally do, their samples are often misdiagnosed because general doctor might see depression. but miss the brain injuries causing it. To fix this, we need a warm hand-off between the mental health and the person. True recovery only happens when we stop treating the head and the heart as two different.
Because CTE can only be diagnosed first, soon after death, prevention is currently the most important strategy for reducing its impact. As research continues to show a connection between repetitive head trauma and long-term neurological disorders, prevention of CTE in sports must involve ethical responsibility, public policy, and leadership in the healthcare system. Concussions are especially common in youth and high school sports. Many occur in contact sports like football and ice hockey. Research shows that most concussions happen during competition and are largely caused by player contact. Each year, millions of adolescents participate in organized sports, so even a small percentage of concussions becomes a major public health concern. Repeated concussions and even subconcussive impacts are believed to increase the risk of long-term neurological conditions, which makes early intervention extremely important. Several prevention strategies have been introduced, but their effectiveness differs. Evidence suggests that rule modifications and strict enforcement are among the most effective approaches. For example, limiting body checking, teaching safer tackling techniques, and reducing contact drink practices have all been linked to decrease head and neck injuries. Education programs for athletes, coaches, and parents have improved awareness of concussion symptoms, but research shows that education alone does not reduce concussion rates. In addition, many parents report not receiving enough information about CTE from schools or sports organizations, which raises concerns about informed decision making. There are also other important ethical concerns. Young athletes may feel pressure to continue playing despite experiencing symptoms, placing competition above their long-term health. When parents do not have adequate information about the risks of repeated head injuries, true informed consent for their children becomes difficult. This creates an ethical responsibility for schools, sports organizations, and policymakers to prioritize athlete safety. The healthcare system also plays a critical role for both management and prevention. Identifying, diagnosing an injury, managing return to play decisions, and preventing secondary injuries are all responsibilities of the healthcare professional. Young players also have legal protections, like having to be removed from play, then being medically cleared to return. For example, Ontario passed concussion safety requirements called Rowan's Law, which focuses on improving awareness, education, and accountability for concussions. Future prevention efforts can be improved by delaying the introduction of contact in youth sports, making changes to practices or laws to minimize repetitive head impacts, improving standardization of return to play rules, improving injury reporting, and increasing education for families. More education for families is needed, as well as more studies to understand the long-term impacts of head injuries. To conclude, participation in sports offers many physical, mental, and social benefits for Canadian youth. However, stronger policies, ethical responsibility, and coordinated healthcare oversight are needed to reduce concussion risks and the potential development of CTE. The goal is not to eliminate sports altogether, but to make them safer by promoting a culture of prevention and prioritizing long-term brain health. Thank you.